If I was getting ready to graduate from dental school, what advice would I give to anyone? First, I would make sure I had a good associateship or internship where I could really get a lot of clinical experience, get my reps in. And some people might think, well, why would not start a practice right off the bat? I personally think most dentists, when they're graduating from dental school, are just barely not dangerous. And I would put myself in that same category. Get as much experience as you can in dental school, but at the end of the day, there's still so many things you may not have come across, just not because you're not good as a clinician, just because of volume. It's just like anything. It's like you have to do your push-ups, you have to get your reps in to really get good at doing basic operative, doing endodontics, doing extractions, doing good crown and bridge, placing implants, lots of different things that you may have had exposure to in dental school, but it's really not enough to feel clinically competent. And what you don't want to do is finish dental school, move to your hometown that you want to live the rest of your life, and mess up a lot of cases and have a bad reputation of not a good skilled clinician. That's something you don't want to do, or that you're just super slow, because that's the other thing. You could possibly be decent, but if your work is super slow or it's not good quality, that's not a good thing. And so if you can be in a situation where you can get a lot of reps, be that at a good private practice, probably somewhere you may not want to live the rest of your life, but somewhere that's very busy. That's one of the biggest things. I would make sure that the office is busy, that they're going to be able to let you be provided lots of cases, do lots of various cases, and hopefully have a senior dentist that's going to be able to mentor you, show you the ropes, and really take you under their wing to show you how to not only be good clinically, but also how a good practice should run. Those are all things I would look for. This could also be done in an internship, be that a GPR or an AGD. You probably won't get the private practice side of it, but at least you could get really good with clinical work, even a Medicaid type state sponsored clinic where they do a lot of free or reduced fee dental work, and that's somewhere that you can really get your reps in. That's something I would really learn how to do. I would also, while you're there, really hone your skills on knowing how to diagnose and treatment plan. You can do that on the job. There's also a lot of great CE out there to learn how to really diagnose, how to treatment plan, how to have good communication with your patients, good conversations where they know, like, and trust you. How do you handle cases that may not go well? What if your endo fails? What if your implant fails? How do you handle that conversation in a positive way? All those things are things you want to really hone in before you start your practice. And it doesn't necessarily have to take a long time. It could be a year or two, a couple years. If you're in a good situation where you can really hone your skills, save money, really make a lot of money, if you could, hopefully you're busy where you can save and make a lot of money, start paying off debt, set money aside. That way, when you do either buy into a private practice or start your own, that you can really be in a situation where you can run right off the bat. So those are some of the biggest things I would recommend for anybody getting out of dental school.